Hi, I'm Annie and I'm on the staff at NAMI Delaware. Today, you're watching a Facebook Live where we'll be talking about gun violence and its impact on mental health. But first, I'd like to tell you a little bit about our agency. NAMI stands for National Alliance on Mental Illness. And NAMI is the nation's largest grassroots mental health organization. It's been in operation for over 40 years. There is a NAMI in every state, and we represent NAMI Delaware. Each state agency operates independently, serving its community specifically to their needs. NAMI Delaware offers a variety of programming and support and awareness events throughout the state. I'd like to tell you about a couple of those now. First of all, before the COVID pandemic, we were offering support groups and programming in all three counties at various locations. We were also bringing trainings and events to private locations such as faith communities, school communities, businesses, and so forth. Since the pandemic began, we moved things to a virtual platform. So we're offering support groups now using Zoom, where you can tune in with a registration link that we'll send you privately. And these support groups are for peers. We also have support groups for family members. You can learn more about getting connected to those by looking at our website, namidelaware.org. We also have education programs that we'll be offering virtually, and there are a variety of different ones. So please check our website to see what might suit you or those you care about. And lastly, I'd like to let you know that we do offer customized trainings even now during the pandemic. We're doing it virtually and we're customizing those to serve various needs throughout the community and addressing issues that might be coming up specific to COVID or issues that are general, more specific to what NAMI Delaware typically addresses. So, because we bring support, education, and advocacy to those who are affected by mental illness, our topics vary, and we'd be happy to talk to you about how we might help you. Please check out our helpline, learn about our housing program. We have a lot to offer throughout the state, and we hope that you, if you don't know about us yet, we hope that you get connected soon. So, today, our topic is very sensitive. We're talking about gun violence as it relates to mental health. Our guests today are not mental health clinicians, they're advocates. We have the executive director of the Delaware Coalition Against Gun Violence, Tracy Murphy. And we also have peer advocate and NAMI Delaware Sharing Hope facilitator, Nimade Bewu. We want to start a conversation today. We want to dispel myths, and we want to talk about action steps that people can take to help reduce gun violence. But remember, NAMI Delaware and Delaware Coalition Against Gun Violence are nonpartisan agencies. We're focused on advocacy and education. So this conversation is not political. Our goal is to raise awareness to help save lives. Now, we want to make sure you feel supported during our conversation today. We want to make sure that you have immediate crisis support should you need it. So you're going to see on your screen a couple of options that you can access to receive that support. You can access the National Crisis Text Line by texting 741-741, or you can access the Delaware Hopeline by texting DE Hope to 55753. Please take care of yourself. Please know that you're not alone, and please know that this conversation is to help generate awareness and information. And there are people in the community who can help you in a variety of ways. Just stay connected and don't lose hope. Stay with us. We have lots to talk about. All right, so let me introduce our guests today. We have Nimade and Tracy. Hi.
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 Thanks for being here today.
Thank you so much for having us.
Thank you, Annie and Nimade. It's so nice to see you both virtually.
Yes. The way that we are seeing each other these days, right?
Yeah.
So let's just start with a quick intro. Why don't you tell me why you want to do this today? Why do we want to talk about this?
Do you want me to go first? I'll go first.
Sure.
So my name is Nimade Bewu. I am, as Annie mentioned, I am a peer advocate for NAMI and the facilitator for our Sharing Hope Community Conversations group. I think it's important to have this conversation. It's because it's something that touches almost everybody. Even if it's not someone you know directly, we're constantly bombarded with news of different gun violence issues throughout the community and the world, and it has an impact on us as a trauma impact on everyone. And I think there's also a lot of misconceptions out there about gun violence. And I'm a firm believer that the best way to resolve and address issues is to increase knowledge. So I'm hoping by having these conversations that we'll increase knowledge and understanding, and that's what's going to help dispel the stigmas and the different things around it. So that's why I'm here.
Thank you. That's great. Tracy?
Thank you. So I'm the executive director of the Delaware Coalition Against Gun Violence. We are a nonpartisan advocacy and education organization, and we focus on sharing information about existing gun violence prevention strategies and legislation in every county, in every community, in every city in Delaware. We have a gun violence problem in America, and we have a gun violence problem in Delaware. There are more guns than people nationwide, more guns than people. And yet, gun violence has never been, maybe until pretty recently, a very much explored or talked about topic. For example, if I bring my children to see a friend and, you know, I have a conversation with that mom about peanut allergies or bee stings, but it's not been normalized in our society to talk about the presence of a gun in a home. And so one of my main objectives in my work is to make sure that people understand the risks and the responsibilities of firearm ownership and put into place really simple strategies to keep themselves and their families safe.
Great. Thank you. And that's a really key point with children in the home. We want to be able to have open conversations with friends. That certainly, when I raised my kids, that wasn't something I would feel welcome to talk about with a child's parent. And that's absolutely critical. So before we dive into too much conversation, I want to make a really important point. There is a common myth that people with mental illness are violent. And NAMI Delaware does a lot of trainings and a lot of awareness events. And we always make sure we address that myth because it is, in fact, a myth. Most people who live with mental illness are not violent. In fact, it's far more likely for someone with mental illness to be the victim of violence. And only about 4% of violent acts in the United States are attributed to people who have a mental illness. So let me ask you all this. Given what I just shared with you, why should we be talking about gun violence with NAMI Delaware?
So I think that that's a really interesting area of gun violence prevention. Is first we have to know how gun violence is happening and how it's perpetrated. And I think one of the areas that is a big misconception is that it's people who are mentally ill that are perpetrating gun violence. And actually, that's not really true.
Right.
One area where mental illness or mental health, behavioral health, and wellness and gun violence intersects broadly is suicide.
Yes.
And I think that's really an important conversation to have. Again, going back to smart and responsible firearm ownership and how that can prevent suicide is a really actionable area of this conversation.
Right. How many gun deaths are actually suicides? It's an astounding number, isn't it?
It's an astounding number. Nationwide, that average is approximately 2/3.
Yeah. So 2/3 of people who are dying by gun are dying by suicide. We don't hear that. Nimade was talking about the media. We don't hear that shared in the media. We hear about these tragedies, certainly, and newsworthy events that are happening that people do want to know about, but we don't hear about the most common way people die by gun, and that's suicide.
And it's a huge problem, especially, you know, we hear about suicide, we talk about it, well, not nearly enough, but we really fail to mention that a large number of suicides are actually done by men, and it's because so many of them use firearm. And so because of it, where you can, you know, rush somebody who takes pills or does something else to the hospital, you don't really have that same ability with somebody who uses firearms. 85% of the people who pass away from suicide, have fatal suicide attempts, are because they use firearms versus less than 5% of everybody else. And
Right.
a large number of people between the ages of, I believe, 16 to 34 use firearms. And that's why it's a huge problem. You know, we talk about gun violence in general, but suicide is such a taboo conversation
It is.
still. Even as we talk about mental health more often, suicide is still very much like, oh, let's not talk about it.
Mhm.
As though not talking about it will stop it from happening, which is the exact opposite.
Right. That's such a myth. And it's another one that we address with NAMI Delaware trainings. We talk about there is a myth around the idea if you talk to someone about suicide, they're going to get the idea.
Mhm.
And what I often say is if you think someone's thinking about suicide, you're not going to give them the idea because they probably have already had the idea. And if you ask them, we know that research shows if you ask them with genuine, authentic kindness and with concern, you're going to reduce their risk of taking action. And when you have something like a firearm accessible, their likelihood of accessing that with, with ease, especially if they're feeling isolated and no one has asked them that question, that's tragic. And I think that's why we want to lean into this conversation, even though it's difficult. And absolutely, Nimade, like you said, it's taboo and people don't want to talk about it, but that's why we're here. We want to have these conversations that are tough. And I'm so glad that both of you are here to talk about them with us.
And I wanted to mention, because you mentioned accessibility, that's a huge part of the issue. 82% of people under the age of 17 who use firearms got them from a friend or family member. And most often it's a parent. And 2/3 of them, it's because they were unlocked. And I know Tracy and I had a conversation once about the locking and the perfect, or not perfect, but better care of firearms. I grew up in upstate New York, so I'm not anti-gun. I'm used to being around guns because of hunters. So I'm like, okay, but it's just so very important to lock them up. And as you mentioned, Tracy, it's not normal for people to have that conversation. Like, do you have a firearm? Is it locked up? But a lot of places where those conversations especially should be happening, like I said, in upstate New York, where there's hunting, things like that, in different rural areas, that's where the conversation doesn't happen. And that's where it needs to happen the most, because again, 2/3 of them, the firearms weren't locked up.
Yeah.
Well, I think it's really important to recognize that Delaware has two really specific pieces of legislation that have been passed in the last couple of years that are designed specifically with this in mind. The one that was passed last spring, and signed into law immediately is a safe storage bill. It essentially requires people who own firearms to store them safely in homes where children or persons prohibited frequent. So persons prohibited can run the gamut from someone who was convicted of a felony, someone who is younger than 18. That's a person prohibited. And there are lots of different points on that spectrum in between. But specifically in homes with persons prohibited, firearms are required to be stored unloaded, locked, and separate from ammunition. And I think this is really, really critical when we talk about suicide by firearm, because we know, and I'm going to refer to my statistics because I want to make sure I have it right.
It's great. You did your homework.
I always do. 24% of people said they deliberated about suicide for less than 5 minutes. Annie, is that right?
Yeah, that is right. That is right.
So I think it's important to
24% for less than 5 minutes. I know what study you're referring to. You're referring to the interview with survivors of attempts in Houston. They did a study.
I was shocked by that number.
It's shocking. Yeah.
So 24% of people who survived a suicide deliberated about it for less than 5 minutes. Imagine if they had to find a key to a gun safe, find a separate key to where ammunition was stored, and put those pieces together. There are so many steps involved in that for someone in the home or in their life to intervene, or for that person to take a second look at what's happening.
To take another thought. Yeah.
And so I think that alone is a really critical step for firearm safety. But another one, and I hope there are some parents watching who can reflect on how many hours their children have spent at home over the past 3 months. The first couple of months of that, if I remember correctly, at least in Newcastle County, I feel like it rained every day. All day.
It did seem like that, didn't it?
And mom and dad are busy trying to work, if they can, from home, or trying to cobble together some sort of schedule of childcare if mom or dad is an essential worker, if it's a single parent household and they're putting together childcare strategies. Imagine what those curious children have gotten up to. And I know from my own children what sorts of things they have stumbled upon in the months that we were home. And I imagine that in homes with firearms, that's an added level of responsibility. Children are naturally curious. That's the reason we all have the poison control phone number taped to our fridge. Children are naturally curious. And it is the job of the adults in their lives to protect them from poisoning, from touching the hot oven, from firearms. All of that falls under the category of home safety.
Right. And you know what I'm hearing from both of you, and I know I could speak to this too, none of us is saying that there should be no guns in homes. That's not what we're saying. We're not saying gun ownership should not happen. We're not mandating that or spreading that idea at all. We're simply saying that safety is critical. Just like any other ownership of anything, we need to be safe. And when we're thinking about, this is a lethal thing.
No, I was just going to say, like, it's almost surprising how many, we talk about adults and teens and suicide, but just general proper gun care, because how many toddlers, like the amount of shootings that happen with toddlers from finding guns, or two friends where they were kids and they were just playing with the gun and it accidentally went off. And those are most heartbreaking because it's so preventable.
It's so preventable. It's 100% preventable. I've heard Tracy say that. It's 100% preventable. I'm saying your line, Tracy.
That's okay. I have many. But I also think along that same line, we always hear about children finding a gun to a tragic and disastrous consequence. It's not just in homes that we need to store our guns properly. We need to make sure if we travel with a gun in our car, that it is also unloaded separate from it.
Sure.
Children are natural puzzle solvers.
Right.
They are not toys for children. I believe everyone in America has seen or had their child play with the toy. That's the little bucket with the pegs, and you put the cylinder in the cylinder hole and the square in the square hole. Children know from a very young age how to put things together. They can figure it out.
Right.
And we can never underestimate their curiosity and their willingness to play and practice.
And to circle back on the ideas of mental health, think of the impact not only of the loss of life, but the ripple effect of how many people are affected emotionally by that loss. So not only just the tragedy in itself, right? That these people that we may not know and we think that's horrible, oh my goodness. But now think, if it were close to you, how many lives did that loss affect and impact through trauma? I mean, they were traumatized by this preventable loss. And we know now, and Nimad and I have talked about this on a few occasions about trauma, that trauma isn't mental illness. They're not the same thing, but they do overlap. And there is an impact that being exposed to trauma is oftentimes connected to a developing mental illness eventually. It might not always, but more and more research is showing that connection. And we have to think about that through that lens. Certainly, I feel a responsibility to do that in facilitating this conversation, to keep circling back on the mental health aspect of these gun violence conversations. Is there anything else related to what we did talk about suicide, and certainly I don't know that we mentioned that suicide is the second leading cause of death for young people. And that's in 3 age categories. It's ages 10 to 14. So think about that. 10 to 14, 15 to 24, and 25 to 34. Suicide is the second leading cause of death. So I think that's a piece of this conversation too. And I think there's other legislation that kind of connects to that, right, Tracy?
There is. We passed in the year before last, we passed 2 bills in Delaware. I should also share back to our original conversation about how gun violence is not a left or right issue. These bills were passed unanimously in Delaware. Republicans and Democrats voted for their passage. One of the bills was called the Beau Biden bill, and it expanded the definition of a person prohibited to include people who were in a danger to themselves or someone else due to an illness. We also passed what's commonly called and often called a red flag bill, or a lethal violence protection order, or an extreme risk protection order.
I think red flag is what people hear. NAMI is, it's not the favorite term for us, but
right.
But yes,
we don't like the term, but yes. And
sure.
that bill has basically allowed provisions in Delaware for people to call, and a process has been is now in place for someone to call if someone that in their life, if they are worried about the safety of someone in their life due to the presence of firearms in the home or firearm ownership. So a really good example of this that would be maybe someone is worried about their aging parents. Maybe mom or dad are running into some financial instability. Mom or dad are running into some health concerns, and family members think, I don't think they should own guns anymore. We often have this conversation about aging Americans and driving.
Yes.
How we should take
taking driver license. Yeah.
And we think about, well, maybe we should get them retested for a driver's license. Is their reaction time what it used to be? Are they making the best decisions with all the information at hand? Are they able to focus on good decision making in a crisis? And if not, we often advocate for people to not being allowed to drive anymore. The red flag law does a similar thing with firearm ownership. It basically affords someone the opportunity to petition the court and say, please temporarily remove guns from these premises until this situation stabilizes. So this is not a permanent order. It doesn't render guns to be never allowed back in the home. It doesn't impact that person's long-term capacity. If they are a hunter or a sportsman, they can continue on with their hobby once that moment of crisis has passed. But it is a temporary order served by law enforcement and supported by the Justice of the Peace Courts. And I should share, because we're still in the middle, although it feels like the end, but I think in the middle of a pandemic, that when other courts in Delaware closed, the Justice of the Peace Courts stayed open. And one of the reasons was because they have to remain available to serve lethal violence protection orders 24 hours a day, 7 days a week, 365 days a year.
So if the family just call, how would someone go about doing that? Let's say there's someone viewing this right now who's thinking of a loved one and they're concerned and they would like to enact this or pursue it. What would be the steps that they would need to take?
It's 4 things.
Okay.
Pick up the phone and press 911.
Got it. Okay. And just say, I know about,
Yes. I am calling to request a temporary restraining order. I'm worried about someone in my life who has a gun.
Got it.
It's just that simple. And the law enforcement officers are trained in every municipality in Delaware, including the University of Delaware Police.
Okay.
Who I know for sure have had to put this in place in several instances.
Okay.
So
well, good to know.
I feel like protection orders are being served in Delaware regularly.
Right. And let me just remind anyone who's tuning in right now, you can put in your questions in the comments. I'm checking at the questions, and did you see Charles say yay, NAMI? So thank you, Charles. We encourage you to post any questions that you might have for us to talk about here. But I do have a follow up to what we were just talking about. What do you think, Nimade, about this legislation Tracy just shared? Would that be a piece of your advocacy when you're talking with family members and peers about mental illness and stigma? Does that connect at all?
It does, and actually, I'm glad you asked, because I was going to ask a follow-up question. Because I think that it's a great legislation. I think more people need to know about it, especially as we're in this time of the pandemic. And then obviously we all know about all the racial related issues, cop related, like people are at extremes right now. And I've seen so many videos of people who are freaking out, who literally look like they are on the verge. And I think in those cases, it's good to know, as Tracy mentioned, that it's not something that's permanent, but maybe just right now, while you're just like I saw one where a lady walked into the police station. She's like, I'm just so tired of talking about race. And you can tell it just really.
Oh, wow. She just had it.
Had it. And I just feel like in those situations, maybe they don't need a firearm in the house right now while they're at a heightened state. Now, the whole conversation about race and all that stuff is like a whole other can of worms, which we won't get into in this call. But I do think that some people are just overly, like they were already here with the pandemic, and now you added in like protest.
No, it's true.
Everybody talking about race. And while it's definitely a conversation that's needed to happen for years, having that conversation right now on top of everything else is a lot for a lot of people. A backup question I did have, though, with that, Tracy, I recently found out, which I was very sad to find out, that people with mental illness, when cops are called for like mental illness situations, they have a much higher percentage of, unfortunately, having it end fatally. So knowing that and knowing other concerns people have about law enforcement, is there any other way to seek help? Like, would it only be calling the cops? Like, is there like something through NAMI or another like mental health facilitation where someone might feel more comfortable reaching out to them than being, because I think that holds people back as well. They're like, this person's having a crisis, but I don't want the cops to come, think that they're harmful, and then now that person's dead. So is there any other way that someone can reach out to enact this or get help with this?
I think that's a great question. And I think that for my area, for my lane, we focus on the legislative opportunities and work to make sure that people who want to intervene are protected and able to do so. There are myriad ways for people to intervene outside of specific legislation. For example, calling crisis text or hotlines. Engaging
crisis intervention services in Delaware, which we just spoke with them last week. That would be a call that they could probably, my guess would be, in calling crisis, they could make that connection, that soft handoff to enact the legislation we're discussing.
Yeah, because I know when I was
without calling directly 911, because I think that's that's a really good point. People are less likely to call those three numbers if they've had bad experiences, they've heard of bad experiences. And people with mental illness do have a higher incidence of interactions with the criminal justice system in general anyway. So there is some concern around that. But I would think calling us, we could help that too.
Yeah, I was gonna say, I remember I texted you right away when I was
you did.
I was so shocked that it was just such a high percentage. And it really makes sense. People talk a lot about the law enforcement, but they really do have a lot on their shoulders, and they have so many roles that they have to play within their role of being a cop. And that's why I had messaged you to find out, like, well, what's the mental health aspect of it, like, for them and for when they're dealing with mental health crisis, because that person going through that, like, maybe they need to have someone from a NAMI or someone with them in that situation. So I just feel like reaching out people, if they knew that there was other ways to get that person help besides necessarily calling
Right. Well, I
violence.
can tell you that the law enforcement in Delaware works closely with, or our agency works closely with the law enforcement agencies in Delaware. I should say it that way. We help facilitate and coordinate the training called crisis intervention training, and that helps law enforcement officers to understand how to de-escalate situations. That could be a different Facebook Live for sure, and we could have that conversation. But in short, there are officers who have that special designation. They have a little pin on their uniforms that show that they are CIT trained, and they have de-escalation skills in the realm of mental health that would help in situations that we're talking about. So if you did call and for whatever reason weren't able to connect with crisis intervention or preferred to call the police, you could request an officer with that training.
Yeah,
Now,
and I think
in
as we talk
various
about,
agencies, I can't guarantee that would happen, but that would be a step, and that would be something that we could help facilitate in, bringing to communities that might not have those officers trained. We did just get a question actually connected to what we're talking about. Charles would like to ask if mental health laws are uniform or if they vary from state to state pertaining to guns. Oh, did we lose Tracy? We might have lost Tracy for a minute. I don't know, but I think I can take that question for a minute anyway, until Tracy comes back. I think there are levels of legislation. So there are legislation efforts at the state level, which is what Tracy was talking about before. But then there are also federal laws that are passed that are just that. They are nationwide. I think in regards to what we're talking about right now, Tracy was talking about Delaware. I think each state would have a NAMI, certainly, that shows, hey, Tracy, nice to have you back. That's okay. We're just talking about the gun legislation question Charles had. I think each NAMI, if you're in a different state, you could start there by checking out the advocacy page on their website, or just go to the national NAMI website, and then from there view their advocacy platform, and then filter back down to the state that you're looking into. Did you want to follow up on that, Tracy, at all,
Yeah,
with regard to legislation in other states?
that's similar to most gun violence prevention legislation. There's very little federal gun violence prevention legislation that's current right now.
Right.
Most states are working toward their own slate of gun violence prevention legislation, and different states have different levels of compatibility. But there are a number of states that have lethal violence or extreme risk protection orders, and there are almost every state has a state agency like mine that works on the streamlining and dissemination of information about gun safety, responsible gun ownership, and gun safety legislation in particular.
That's great. Thank you. Hopefully that helps, Charles.
Oh, no, sorry. I was just going to say, and I just wanted to mention, as we continue to talk about gun violence, I think it's important that we keep stressing that gun violence is really an issue, not only that affects everybody else, or that affects everybody, but with a lot of self-harm, with mental illness. It's highly impacted by that, because we get so much from the media about being worried about people with mental illness and guns. And the minute someone sees the word, like we're talking about gun violence, they think we want to take guns away. And we've discussed in this, we don't want to take them away. We want them to be responsible gun owners, because, as you mentioned earlier, only about 3% of violent gun crimes are with someone with mental illness. For mass shootings, everyone instantly thinks mass shootings, guns. That only 1% of mass shootings are mental illness related. And I think it's great that we've come to this place where we're talking more and more about mental illness, but it's also slowly becoming almost a scapegoat for a lot of situations. Like, there's a mass shooting, it must be mental illness.
Right.
Someone did something and said something really obnoxious and wrong, like the message I sent you the other day with the woman. Like, it must be mental illness.
Have been a mental illness, yeah.
And then that creates a whole nother stigma that people with mental illness are dangerous and harmful, and they're not. And then especially when we talk about gun violence, a large majority of the gun violence issue is self-harm.
Right,
Mhm.
right. Absolutely. Everything you said. I think the stigma piece is huge. So it's really hard for people who are advocating for mental illness, for those of us who teach and train to not address, and it's critical that we do address how much stigma there is, especially regarding what people who are thinking about needing help might worry that others will think about them. You know, how will I be judged? Right. And the stigma piece is huge. And when we hear on the media constantly that these incidents that, like you were saying, Imane, were related to mental health, which they were not, that person who was thinking about making the phone call to reach out for help has just put the phone back down because they've realized, well, I don't want them to think that about me. I
Mhm.
don't I don't I don't want them I don't want to be judged that way. So it's a really difficult conversation to have, but you know what? It's important that we have it. And I hope this is just the beginning of these conversations. I hope that we can continue to address these myths, and we can continue to inform, as you were saying, is so important. When we have myths, we want to bring the real information, and also to give people opportunities to take action. What can people do who are viewing this video, either live or later? What can they do to take action against these concerns, or with or about these concerns that we have today? Does anybody have any suggestions?
Yeah, I think so. I was actually just making some notes while you were talking because I think you brought up so many really important points that are on the fringes of this conversation. So we know that a mental illness is not a correlation to your likelihood to be involved in gun violence.
That's right.
But we also know at the same time
Mm-hmm.
that mental wellness reduces all instances of violence.
Yep.
And so I think it's really important that we recognize the value of mental and behavioral wellness,
Mm-hmm.
and how much of that we can incorporate into society and do a better job of creating a culture of wellness.
That's right.
And that will bring down our numbers of violence in every kind of violence.
Being
Every
proactive, right?
Yes.
Yeah,
So
absolutely.
when we, right now in Delaware in particular and nationwide, to some of the points we were talking about earlier, there's a real call for racial justice.
Yes.
And there's a call for a sort of reckoning. It's a time of national reckoning about police brutality, racial justice, and all of this kind of falls
Inequity.
Equity. It falls under the really large umbrella of raising the level of wellness in our communities across the board.
Right.
And it's important to recognize that all of that is about changing the culture, right? All of that falls under the category of changing the culture. And if we do a better job as a community, as a country, of changing the culture of destigmatizing mental wellness and mental illness,
Mm-hmm.
and destigmatizing conversations about gun use and gun violence, will we see a change in both of those and how they intersect together? And I think we will.
I think we will too.
Just as an aside, look at, I like to point this out in conversations because it gives people the chance to reflect a little bit on simple things they can do to start to change their culture.
Mm-hmm.
For example, when we were setting up this talk today, you may have said, well, I'll shoot you an email. We'll include bullet points.
Yes. Language. Absolutely. Language.
This is trigger. Somebody might be triggered, or there's a trigger warning.
These are all words that we try not to use. Absolutely.
And I think it's really critical that not just people who are doing mental health work or gun violence work or advocacy work recognize that gun violence is very normalized. And gun ownership is very normalized in our country in a way that it isn't in other countries around the globe.
That's right.
And once you start to recognize the issue, the concern is when you have the opportunity to change it.
Sure. It's like what we talk about with the word crazy. How many times is that? Was that what you're going to say, Nimade?
Well, I was going to say that crazy is definitely one of those, like, since we had our training, I'm very aware of how often I say, like, that's so crazy, this is crazy, and trying to stop yourself.
It's hard.
It's hard. And I was also going to mention that, Tracy, what you mentioned about mental wellness is huge. We don't even have the time to get into the other side of this gun violence conversation, which is the trauma of communities that are dealing with it. You know, people who live around constant gun violence have trauma levels similar to those who have PTSD, but they think that it's normal and that living like that should be a part of their day and they should just get over it. But no, they shouldn't. They should be seeking out ways to get help, to get that mental wellness. And that's a whole nother part of, you know, like a whole nother section of the gun violence conversation, which is what's happening in the cities and different rural areas or urban areas, where gun violence is very prevalent, and how that affects everybody's both physical safety and their mental safety, just hearing those noises and being worried. And then, you know, Charles mentioned in the chat about the virus and unemployment, all of that stacks up. Everything is just, and I think that, you know, when people wonder like why even the whole George Floyd thing became such a powder keg, I think part of it is because we were just overall, we, the African community, was just sick of police brutality and things like that we've had over the years. But a large part of it is the fact that it was stacked on top of the pandemic and everyone was home and everyone was stressed. And then this happened. It was just like, whoosh. And part of that is from the years of mental trauma dealing with those situations. You know, Trayvon Martin happened. Like, how many people sought help after that? I cried, you know, when different shootings and different situations have happened that haven't even been directly related to me, have been traumatic for me, have caused me tears and sadness. So I can't imagine the level with which someone who's living in it, who has their neighbor down the street who was shot, and then their friend down the block who was shot, like how that mentally affects it. Because I know how badly the couple a year I hear about mentally affect me. I couldn't imagine having it on a regular basis. And so that mental wellness and taking care of it and addressing it, I think, is huge and important, and it needs to be put out there more and more resources. And I know, Tracy, we had our conversation. That's one of the things we really talked about, is like, how can we figure out how to help people and get the resources they need on the community level? And it's a constant conversation that needs to happen.
Absolutely.
I think too, something that I'm getting much more into learning about, and something that I don't think is widely known, is how our brains develop around trauma. And I'm talking specifically about the developing brains of children and adolescents, and how during their time of growth, they are more like, their brain is rapidly growing and rapidly changing. And if children, specifically during their childhood, people are exposed to ongoing trauma, community violence, for example, their brain is likely to change forever as a result of that.
That's right.
And that leads to an ongoing cycle of violence in communities that we see generationally through no fault of the child who was exposed, unfortunately, to episodes of violence during their critical brain development years. And I think it's really important to recognize that. And that leads to the conversation about trauma-informed care and trauma-informed approaches to education, trauma-informed approaches to community policing, trauma-informed approaches to medical interventions. All of this needs to layer into the community's general approach to communities where trauma is more frequently occurring.
Absolutely. Wow. I think I need you back like every day, like for the next month, to cover all the things that we need to talk about.
It's a very nuanced conversation. It's a very nuanced, layered conversation.
It really is. It really is. I want to thank Charles for his great comments, and he's thanking you, Tracy, for your comments on stigma and guns. And I want to thank everybody who's tuned in today. And are there any websites or any suggestions you have for people to access more information that you want to share, or we can maybe add to the comments? Wesley's been wonderful about adding some things as we went.
And unfortunately, I tried to see the comments earlier, and that's what caused me to drop.
Oh, is that what happened? Okay, so we've got Delaware Crisis Intervention posted. We've got information on ERPOs, or extreme risk protection orders. We've got the crisis text line information, and he has already, thankfully, wonderfully streamed your website
great.
at DCAV, and Nimade, your Insta, and your name. So we definitely have those things. I think there are a couple of agencies here in Delaware. Well, there's certainly Moms Demand Action, right?
Yes.
people
great.
could join that, and you don't have to be a mom, right? Isn't it
You don't have
mothers
to
and
be a
others?
mom. It is
Yeah.
mothers and others, and
Right.
I am a mom's volunteer and a mom's
As am
demand
I.
member.
Mhm.
So the way that our organization and Moms Demand partner, there's also March for Our Lives, which is a student-led initiative supporting gun violence prevention work.
And Students Demand Action is brewing. We just need to get back in school to
Yeah, exactly. When
make that happen. But yeah,
students again.
right.
Both Moms Demand, Students Demand, and also March for Our Lives are designed to bring together groups of volunteers to support candidates, support legislation, and support initiatives that can impact change generally at the state and national levels. Our organization sort of picks up where those organizations leave off, and we focus on the public policy implementation. Make sure that people from the various government agencies involved are following the new laws that have been created, find out about the impacts of those laws on their communities and the communities in which they work. And then we take that information and distribute it out like we're doing today. So people know how to access the laws that are designed to keep them safe. Laws like safe storage, laws like extreme risk protection orders, and other legislation around the kinds of guns that can and can't be sold, the kinds of ammunition that can or can't be sold, and that other pieces of legislation that fall under the behaviors more of gun salespeople and manufacturers and less on the general public, which is what we're talking about in this conversation.
Great. And I know that they're Everytown, which I think Moms Demand is actually a part of, right?
Correct.
Everytown has some good resources on the national website that connect to trauma, and they connect to other ways where this conversation today is sort of intersecting. So that might be a good place. And NAMI National also has some policy things. I know Wesley has been posting things in our chat, and I think he did post something from NAMI National. We do have a policy platform that addresses some of these concerns. But really take action, reach out, find ways to help, find ways to connect. Check out Nimade's conversations on is it Tuesday evenings? Right?
Yes, on Tuesday evenings at 8:00, it's called What's on Your Mind. It's a live where I talk to different people, either in the mental health field or just people with different mental health. Because mental health and mental illness are two very different things. Everybody has mental health. 1 in 5 people have a mental illness. So the purpose of it is to talk about mental health. So I talk to a wide variety of people about just what's on their mind and what they're going through and how they're dealing and how they're coping. So that's Tuesday night at 8.
Tuesday nights at 8 on Instagram, right? And
Yep.
your profile is streaming along the bottom. And
That African Butterfly.
That African Butterfly. Well, I have just loved this conversation. This has been great. And hopefully we can do it again, maybe pick up where we left off.
Thank you. I would
Sound
love
good?
that.
All right.
I would, and I know I'll be seeing you, Nimade, on Instagram on Tuesday.
Yeah,
I often am peeking in, and I really look forward to more conversations like this. Thank you both.
Great. Thank you, and thank you very much.
Thank you. Have a great one, everybody. Bye.
Thanks.